Hello everyone and welcome back. I'm Joe Chappelle and you're listening to a special episode of the OBGYN podcast. As you listeners will remember, Jerry Ballas invited me to the National Perinatal Association annual meeting at the beginning of April in Providence, Rhode Island. Until Jerry started telling me about the organization about a year or two ago, I'd never heard of it before, and so I was in for quite a treat, to say the least. What is the National Perinatal Association? What are its goals? Well, actually you'll hear from Jerry later in the series about that exact question. But let me tell you, as a relative newcomer, what I think the NPA is about. In day-to-day practice at, ACOG, SMFM, ASRM, whatever every year, and even on this podcast, we tend to focus on the quote-unquote hard science of medicine, the new medications, the RCTs, meta-analysis. What I found from my 2 days with the National Perinatal Association is that they are about all of the pieces in between those studies, all of the moving parts that we interact with every day and wish could be better, but to try to fix it just feels too complex. That is what I saw the NPA tackle this year at their conference. They had talks on criminal justice, challenges in rural healthcare, community-based approach to postpartum mental health, the effects of communication on cesarean deliveries, and so much more. Each and every talk was about the personal side of medicine, the part where that medication I prescribe is on the same footing as what words I use in communicating why she needs that medication. Attending this conference was exhilarating and rejuvenating. It reminded me of why I got into women's healthcare to begin with, providing the best possible care for women, not the best health care, but the best overall care. And sometimes that means thinking about things other than the latest trial or surgical procedure. I am very happy that Jerry convinced me to go this year, and I am sad that I wasn't able to record all the talks or interview every speaker. Over the next few weeks, you will be hearing interviews from several of those speakers. Now, I'm not a professional interviewer, and because I was excited, I definitely spoke too much. But you can still feel their enthusiasm coming through. I hope that you enjoy these, that they make you want to join the NPA and its mission, or come to next year's conference in Denver. Today, I'm presenting an interview that Dr. Ballas did with Dr. David Gagnon, who was the first president of the National Perinatal Association. He leads us through the early years of the association and what their mission was back then.
My name's Dave Gagnon. I was the vice president of Women and Infants Hospital at the time and had worked in Ohio with the Ohio Perinatal Association and came to Rhode Island and worked to develop a new Women and Infants Hospital. And as vice president, I was also involved in perinatal regionalization, and the result was I got involved with the nascent group of National Perinatal Association, which began in a hot tub in, I think, Columbus, Ohio.
How many organizations can say they started in a hot tub in Columbus, Ohio?
with Stan Graven and Sister Jean and a few others, and that's where I had met them. And the result was Stan and helped to organize the organization, and he had his associated colleague, who was an OBGYN, run the organization. And when it came to the end of his term and I was on the board of directors, we were meeting in one of the cities in the United States that I can't remember. And the board was in the meeting room, and the president-elect knocked on the door, and a fairly distinguished obstetrician gynecologist, who will remain nameless, and said, I'm resigning. I was told by ACOG not to have anything to do with this organization because it isn't a professional group and does not involve professionals from either ACOG or the Academy of Pediatrics. So everyone looked at one another and decided that what are we going to do? And somehow or other, they all looked at me, and Sister Jean, against much argument from me, convinced me to take over an organization that was at that time ready to end. And because I was a vice president of a hospital, and because I had a very sympathetic CEO, he funded me for the next year to travel to some 20 states and work either to develop perinatal organizations or to work with some of the initial organizations that existed in some of the states. And so we started to set up what would become the National Perinatal Association and link it to many of the state associations.
What would you say at that time was the issue, or one of the biggest issues as a perinatal society, that you were going to tackle or address?
Well, I think at that time, you have to remember perinatal regionalization was pretty elementary, or in its very early stages, and it was primarily we were working on developing the concept of perinatal regionalization in states and having support from across all of the disciplines, nursing, the physicians, both OB and neonatal, and actually trying to establish a nexus between all of the groups, because at that time there were distinct silos, and there were distinct differences between, obviously, the physicians, the nurses, even the disciplines themselves. And so our initial organizational structure was built around perinatal organization, and especially getting states at that time to develop perinatal regional programs and start to define things like levels of care.
Now, the current makeup of a lot of the membership and a lot of the leadership is that we are very cross-pollinated now with those associations that initially sounded like forbade some of their members from joining. I'm a member of ACOG, a member of SMFM. Obviously, a lot of our members are members of AAP and midwife associations and so forth. Do you find that as kind of enriching, or
well, I think,
is the
yes.
the rebel aspect of NPA kind of watered down in some ways?
Well, I think we didn't consider ourselves as antithetical to the establishment. Obviously, we saw ourselves as a niche organization that would be interdisciplinary and bringing all the groups together. But there was just this feeling that it wasn't. Why they were so adverse to us, because we were obviously not that strong an organization. We were existing on a lot of voluntary support with a very small membership fee, and most of our money, frankly, came from the conference itself, which at that time had some really lucrative sponsors. We had in 1982, I think, in Dallas, we maybe had 2,500, 3,000 participants. We had a huge supported conference, and money came in. And the one thing that we finally established was a much more solid financial base, and having at that time someone who was part-time who could organize the activities of the organization. But the organization itself was primarily to interact with different state organizations and to act every year in terms of bringing issues in its perinatal conference that were cross-disciplinary.
Right.
So it was, I mean,
It's interesting to hear the arc though, because upwards of a few years ago, we our difficulty was staying solvent, relying on the conference for the main bulk of our income, because a lot of money now is spread amongst all these organizations, and every organization has a sub-organization, and trying to identify sponsors that are able to support multiple different organizations within their framework budgets, and of course the relationship between industry and pharmaceuticals, and that wax and wanes almost on a generational basis. But I like that the drive of a conference based on a topic that brings together multiple specialties seems to be the common thread. And despite that waxing and waning of funding and so forth, I still feel like we attract a pretty active and motivated membership.
well, I think that's always been the case. It's always been young, especially in the area of medicine, young physicians who are neonatologists or maternal fetal medicine, which at that time, remember, maternal fetal medicine in 1979 to 1982 was a pretty small profession. Neonatology, when I first began working in the field of perinatal organization and hospitals, a famous saying was that when they did the trip in the early 70s to one Cayman Islands for a conference, and the airplane had fallen, it would have set back neonatology 20 or 30 years because they would have all died. So we had very few maternal fetal medicine specialists in 1982 around the country. Neonatology was still a relatively new discipline, and so it was an exciting time, and we attracted a lot of younger physicians, but we were especially attractive to nurses who were very committed, and frankly, to public health people from the various departments who were very interested in bringing in the regional programs. And at that time, there was still a lot of debate about levels of care and how could you organize levels of care. So, and that's one of the things that NPA was involved in. I've noticed as I've followed you over the years that you're in more and more to the human aspects of the delivery process and the problems that are encountered by women and infants, and especially infants at risk. I think that's a very good thing, and one that is, I mean, what you've done is you've moved into areas where there isn't as much interest in the necessarily in the disciplines, although there is increasingly so.
Right.
And I mean, that's the same kind of motivation that was behind some of the original.
It's interesting. I feel like in some respects we're on the forefront in some aspects. We've been talking about substance use in pregnancy in the perinatal period now since I started on the board in 2013. I even remember specifically emailing some of my maternal fetal medicine contacts at NIH and so forth about projects, co-sponsorship, and they declined. And then before you know it, 3-4 years later, NICHD's releasing statements about opioid use in pregnancy, and SMFM is coming out with all sorts of statements, and they did not want to get involved 3-4 years ago when we asked them about coming out with a statement about opioid use in pregnancy. So it's interesting on one hand we feel niche, but before you know it, the big organizations catch on.
Yeah. No, I think it's it's been an interesting learning process, and I think a lot of it has to do with younger entrants into both nursing and medicine who have brought about the changes as they feel how much patient-centered care is necessary. And that's now the coin of the realm, so to speak. Patient-centered care is what's necessary in order for us to improve patient safety, patient quality of care.